Hello, I'm Dr. George Ampat and work as a consultant orthopedic surgeon at Liverpool. This is an update following the monthly meeting of the Musculoskeletal Special Interest Group of the British Society of Lifestyle Medicine. Our meetings are run monthly and they are online. All health professionals involved in the care of patients with musculoskeletal problems are encouraged to join this meeting. I'm honored to be part of this excellent team to lead this at the British Society of Lifestyle Medicine. The others in the team are Mr. James Smith, consultant orthopedic surgeon, and Dr. Deepak Ravindran, consultant pain physician. I would sincerely urge you all to join us at the annual conference of the British Society of Lifestyle Medicine in Newcastle, Gateshead. This will be our biggest conference yet. The conference is from the 19th of September until the 21st of September in Newcastle, Gateshead. It promises to bring in speakers from across the globe to provide expert insight into all aspects of lifestyle medicine. The QR code will guide you to the web page regarding the conference. In the lead up to the Congress, this musculoskeletal special interest group is going to focus on the various non-operative programs that are available to help with arthritic pain in the hip and the knee. In February, we discussed the Escape Pain program. We will be discussing the Nuffield Health and Joint Pain program in March 24, Good Life with Osteoarthritis in Denmark in April 24, Better Life with Osteoarthritis from Sweden in May 24, Hip and Knee Training from Germany in June 24, Active with Osteoarthritis from Norway in July 24, and the Otago Exercise Program from New Zealand in August 24. This should lead us well into the BSLM Congress in September 2024. The National Institute of Health and Care Excellence had published some updated guidance regarding osteoarthritis in over 16s in October 2022. The details of this guidance has been very clearly depicted in this infographic published in the British Medical Journal in January 2023. The updated guidance emphasizes on non-pharmacological management of osteoarthritis. The guidance suggests that pharmacological management or providing medications should only be used in the short term to enable patients to engage in therapeutic exercise. The two main areas of non-pharmacological management are exercises and weight management. In exercises, the guidance suggests combining exercise with an educational program to enable behavior change. Consideration should also be provided to supervised exercise sessions. The weight management program should also include an educational element advising the benefits of losing weight and inspiring patients that losing even a small amount of weight is going to be beneficial. As stated previously, we will focus on these 7 programs that have had results published in the public domain. It is possible there are other programs. This is not an exhaustive list. We looked at this peer-reviewed article regarding the Escape Pain program published in 2012 in Arthritis Care and Research. The title of the article was Long-Term Outcomes and Costs of an Integrated Rehabilitation Program for Chronic Knee Pain, a Pragmatic Cluster Randomized Controlled Trial. The authors were Hurley, Walsh, Mitchell, Nicholas, and Patel. The QR code displayed would lead you to the article. The study we are looking at involved participants who were invited to attend 12 supervised sessions twice weekly for 6 weeks. Each session started with a 15 to 20-minute discussion of a specific topic, advising and suggesting simple coping strategies. This was followed by a 35 to 40-minute of exercise program. The intensity and the exercises were varied according to the ability of the individual participants. One of the exercises in the program is sit-stand for 1 minute. This exercise would improve the strength of the muscles in the legs. It involves folding the arms in the front of the chest while in a seated position and then slowly standing up and then returning to the seated position. The same movement should be repeated for 1 whole minute. One can count the number of repetitions one is able to do in 1 whole minute. In this manner, one can see the progress one is making over a period of time. To begin with, one may only be able to perform 3 repetitions every minute. Repeatedly performing this over a period of time, one may find that in a few months, one is able to do many more repetitions within the minute. One of the other exercises in the program is writing alphabets in the air with the great toe. One can sit in a chair or lean back on a couch. Start by mimicking to write each alphabet of the English language in the air with the great toe. To begin with, one may only have the strength to write the letter A, the letter B, and the letter C. Again, repeatedly doing this over a period of time may increase one's ability to write more alphabets as the strength of the muscle improves. This should be repeated on both sides. This exercise not only improves the strength of the muscle but also improves the sensation called proprioception. Proprioception is joint position sense. Proprioception allows us to understand where our limb is in space. This is a sensation that is very commonly used but maybe not clearly understood. As we walk with both our legs and as each foot lands on the ground, that foot provides a feedback to the brain regarding the ground, and that enables the brain to place the other foot appropriately. This is joint position sense in action. Writing the alphabets in the air reinforces that learning. In arthritis, one loses joint position sense or proprioception. Writing alphabets into the air allows the brain to reinforce the position of the joints of the leg and the foot as it moves in various directions. Improving joint position sense decreases falls in older adults. The outcome measure used in this study was the McMaster University's Osteoarthritis Index, or shortly called as the WOMAC. It is a 24-item questionnaire. There are 5 items regarding pain, 2 items regarding stiffness, and 17 items regarding physical function. The difficulty faced in each item is scored on a scale of 0 to 4, where 0 equals no difficulty and 4 equals extremely difficult. This then gives a score between 0 and 96. This is then converted as a percentage for the final score. This is a busy slide and we will only look at the main points. We will limit ourselves to the pain scores on WOMAC. This table provides the scores at baseline, at 6 weeks follow-up, and a 30-month follow-up. At each point, there are 2 columns, one for usual care and one for escape pain participants. In the first column on the bottom line, you will see that the baseline pain was 7.7 for the usual care group and 7.5 for the escape pain group. At 6 weeks, the usual care group decreased their pain to 7.1, whilst the escape group pain decreased their pain to 5.2. At 30 months, the pain score in the usual care group was 6.4, while the escape pain group was 5.9. This shows that even at 30-month follow-up, patients who were randomized to the escape pain program was better than the usual care group. The escape pain group has an excellent website where all their exercises are clearly provided. Escape pain is an acronym and stands for Enabling Self-Management and Coping with Arthritic Pain Using Exercise. The QR code provides a link to their website. They also have an app which is available both on Android and Apple. The app can be downloaded from their website. The QR code provides a link to their website. This is another article published by the same group regarding escape pain. This article reported results of their rollout program in the community. The QR code provides a link to the article. All these links are also available in the text description of this YouTube video. The article reports the results of their community-based program. The exercise was delivered by exercise professionals and not health professionals. The venue of the program were community centers rather than hospitals or clinic. At the start of the program, 24% of the participants were fairly active, doing more than 30 minutes of activity per week. But after the program, nearly 78% of the participants were fairly active or active. And even at 6 months, 69% of the participants were fairly active or active. The cost saving as a result of participating in the escape pain program was £326 per participant. They concluded that older people with chronic joint pain were willing to attend escape pain when delivered by exercise professionals in community centers, and it was found to be as effective as when delivered by physiotherapists in hospitals. Delivering escape pain in the community could facilitate access to the effective care and ongoing support to sustain the benefits of healthcare programs, producing a more efficient use of health and community resources. The main lesson behind this study is that we need to move away from the classical medical model focusing on illness, clinics, and hospitals. We need to turn our dials away from illness and towards wellness, which can be delivered in community centers or gymnasiums. I do demonstrate exercises for neck pain, lower back pain, hip pain, and knee pain available through my website at myselfhelp.org.uk. The QR code leads to that website. In that website or on my YouTube channel, you will notice that I am doing the exercises. A pudgy fat man rather than a lean, mean fighting machine. If I can do these exercises, anyone can. Please feel free to recommend this website and these exercises to your patients. This is a completely free resource available to patients. Once again, a reminder of the lifestyle medicine for musculoskeletal pain that we are running in November of this year. More importantly, if you are a health professional, we would like you to join the British Society of Lifestyle Medicine. We are the prime organization transforming healthcare and leveling health inequalities through lifestyle medicine. United, we can make a big difference. Thank you so much for listening. If you like this video, please click on the like button. Please also support this video channel by subscribing to it. The free channel and the free videos are only possible with your support. Thank you so much.